there's so many problems in the broken healthcare system. But I got to tell you, ultimately, me personally, I'm a freedom guy. If you want to poison yourself, go ahead.
And so then I get it checked out, and they show it up on the screen, Jack, in the hospital, and there's my bowels. I'm like, oh, that's really cool. And my best friend was like, not really, because where you have two, you're supposed to have three.
And there are quality scores out there, and Wendy's surgeons they scored through the roof. They were very high. But they're people, and sometimes mistakes happen.
Are you sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am delighted to have our guest, Dr. Jack Wolfson and Wendy Stevens. And welcome, Dr. Wolfson. Pleasure having you here today. Thank you so much for joining. We're going to learn what the Jack-Wendy connection is in a moment. But I'll tell you, I'd like to start at the beginning. And the reason that I'm thrilled to have you on as a guest is because, as our audience knows, our mission is to help the American people understand not only the business side of what's going on in healthcare, which involves insurance and procuring the best surgeon, the best facility, the best doctors, the best practices, focusing on the cost, because in everything that we procure, we focus on the cost, except healthcare, believe it or not. And there is there's kind of an inverse value proposition in healthcare. Typically, the highest cost is the lowest quality, and the lowest cost is typically the highest quality, and that relates to cost and efficiencies. And, another aspect of this that I think most brokers, advisors don't touch on is the health of oneself and being the best brand steward for ourselves and our bodies. And that can certainly result down the road in a lot less financial pain just by simply doing the right things. And, it's funny, I have a neighbor across the street that I ran into, and this is before I knew that I was going to interview you, Dr. Wolfson. And then I looked up your bio, and I was like, oh my God, like right on his homepage, it says something about statins. And I want to read you my text exchange, Dr. Wolfson, and then if you would comment, I think this would be a great place to start. So, I basically reach out and I say, hey, I'm interviewing a cardiologist tomorrow and thought of you. I'm going to send you a screenshot. I'm pretty sure I can make an introduction if you're interested. And so, your screenshot basically says like, drugs is not the way to go. I'm paraphrasing. And he says, hey, Ray, thanks for thinking of me. I'm still searching for answers so that would be great if you can. Thanks. And then he follows up and he says, not sure if you'll be able to get it to the doctor or be interested, but here's a quick summary. Firefighter for 19 years, exposed to a lot of shit. Those are his exact words. Smoked and drank all through 20s with poor eating habits. Found out right before Thanksgiving, 25% blockage of the Widowmaker, cholesterol 210, LDL 138, started diet and exercise, went from 234 pounds to 192 pounds, cholesterol now 149, LDL 95. I really don't want to take statins if I don't have to. Maybe too much info, but if it comes up, you have something to tell him. So what do you think, Doc?
Well, first of all, thanks so much for having me on the show, and it's a pleasure to meet you, and also, of course, to see my old friend Wendy Stevens. And when I say old, I mean I've known her for years. Not that she's old, because she's not, and she's one of the youngest people that I've ever met. That being said, it's and I love the name of your show as well, because the healthcare system is broken. It's been broken ever since 1910. The control by the Rockefellers, the Flexner Report, really got rid of natural holistic medicine in the early 1900s in favor of the pharmaceutical industry. So fast forward to your neighbor who made these comments. It's just all totally typical, where most people have led very unhealthy lives. And at some point, they want to try and get healthy. And then they go to their medical doctor for health advice. And they get the same conversation that goes like this: improve your diet, exercise, and take these drugs. And that's the way that I was trained as a conventional cardiologist, who would wind up in the biggest group in the state of Arizona for 10 years. And then I would start my own company in 2012, Natural Heart Doctor, where we focus on avoiding the pharmaceuticals. So again, your neighbor is a perfect example where someone has abnormal lipids or abnormal cholesterol and coronary artery disease, and the conventional doctor only sees statin drugs as the therapy, whereas we see everything else besides statin drugs. Statin drugs have side effects, and quite frankly, they really don't work to reduce the incidence of heart attack, stroke, and dying. So people deserve better. People deserve the truth. They need to know about the broken healthcare system. So I appreciate you having me on.
No, it's wonderful. And, I read in a study that cholesterol and who knows, but I'm certainly no medical doctor, but as I understand that the Japanese people have cholesterol that's off the charts, and yet they don't have the same incidence of heart disease as Americans with lower cholesterol levels. I don't know if you could speak to that, or so I guess the question is the LDL, HDL, is that the kind of smoking gun that it's made out to be?
The answer is definitely no. All animal species on planet Earth have LDLs and they have HDLs, and they serve a purpose. Cholesterol, of course, has a purpose. Cholesterol forms our hormones, like our sex hormones. Testosterone, estrogen, progesterone, all comes from cholesterol. Cholesterol is converted by the sun into vitamin D. Everyone knows how important vitamin D is. It comes from cholesterol. When the sun hits the cholesterol in the skin, vitamin D levels go up, cholesterol levels go down. Cholesterol is critical for our digestion. Cholesterol is present in our mother's milk, in animal milk, in eggs, because that's how you grow, these species. And ultimately, every single cell has the cell membrane, or it's a fence around the cell, and that's loaded with cholesterol. So cholesterol is extremely important. LDLs are important. HDLs are important. Now, LDLs can become bad when they're small, dense, and oxidized, but these are all advanced tests that most insurance companies aren't paying for. Most doctors are not familiar with, or they're not ordering those in a routine fashion. But what we're trying to find is the optimal levels for everyone. And I do want to take an opportunity, because I'm very fond of bashing the medical system. But listen, Wendy had significant cardiovascular disease. She needed an urgent surgery, and God bless the men and women who work in those situations in trauma centers and emergencies. But for the prevention, treatment, reversal, post-op care, that Wendy had, the medical system really has nothing. It's really, really faulty. And then once, Wendy would have the emergency procedure, how do we make sure she's on track for the 100-year heart? And the answer is not going to be with pharmaceuticals. Ray, to your point real quick, regarding the Japanese live 7 years longer than we do. And they have double the rate of, if not more, of smoking, for example, than we do. Why do they live longer? Well, they eat better, they live better, they are, physically active. And I think one of the key components really to the Japanese is the fact they eat a lot of seafood compared to typical American consumption. I think that's a big factor for the Japanese. The United States, although we spend by far and away the most amount of money on quote unquote healthcare, which is really sick care, we are very, very low regarding life expectancy, the morbidity issues, the sickness, the chronic disease, the obesity. We're at the worst on the list compared to everybody, despite the multiple trillions spent in this area.
Yeah, and I think to a large extent, it's not our fault. It is our fault. It's not our fault. What do I mean by that? Well, we're bombarded every day with fast food advertisements and drug commercials. Actually, like pharmaceutical companies spending millions and millions of dollars on television advertising to get you to ask for a doctor to prescribe a drug. Is that the way it's intended, right? Was that the intent when a doctor went to medical school, went through training? I'm pretty sure the vast majority of physicians out there, they have good intentions. They want to help people. So is it really like, does it make any sense that we should watch a TV commercial and walk into a doctor's office and ask the physician to prescribe a drug? Isn't that a little ass backwards?
Well, it is an incredible marketing ploy by the pharmaceutical industry. And the pharmaceutical industry is not in the drug development business. They're in the drug sales and marketing business.
Yeah.
That's what they do.
Sure.
That's all that they do. They're not discovering anything. Universities are paid, to discover certain things, and then pharma markets it. So that's all pharma is the biggest marketing conglomerate in the entire world. And to that end, there's so many problems in the broken healthcare system. But I got to tell you, ultimately, me personally, I'm a freedom guy. If you want to poison yourself, go ahead. I'm not going to poison myself or my children. You can't make us do it. That's up to you, freedom. So I don't like the idea of limiting advertising on television really to anything. Again, if some consumer is out there and they are caught up in that marketing message, then that's on them. But the issue really is that where does pharma come up with all this money to do all this marketing?
Yeah.
Where do they come up with that? Well, of course, that goes into the drug industry, that goes into the government, that goes into the insurance, business.
Sure.
So pharma, of course, has all this extra money to market. If the drugs weren't so expensive and the profits weren't so tremendous, there would be no money for the marketing budget. So I don't know if that's really the best way to tackle it, in that as far as, restricting, commercials, because I'm just not a restriction guy. I think, we need to cut off the head, Medusa's head a little bit earlier than that.
Agreed.
Well, Jack, real quick, I so agree with Jack on that one. But being in the marketing space, I do have to say, don't believe me. We'll look it up and have it in the show notes for sure. But pharma spends more than $100 million a minute across the country. Every minute, that's what's going on. So you're right. It is a marketing machine. And so when you can spend that kind of money, it's because, hey, if you spend $1 and you make $5, you'll do it. Right. So You're right. It is about taking off the head of the snake for sure.
Well, without a doubt. And, the reality is between pharma and insurance, they're the two biggest lobbying groups in D.C. Mm-hmm. And together over the past, 20 years, they've spent over $8 billion lobbying and having conversations with Congress and branches of government. What do you think they're talking about? They're not talking about driving down the costs of healthcare. They're talking about making sure that everything just kind of stays exactly where it is, that the train keeps on its track. And, OptumRx, the biggest division of United Healthcare, is by far their biggest profit center. So those are definitely all real issues. But Dr. Wolfson, it's just amazing that you have this megaphone and you're encouraging people to really just do common sense stuff. Like, I know that you're a big proponent of the paleo diet, and you even package, your children's lunch and snacks to bring with them to school. I'd love for you to touch a little bit on that, because again, that's just, it's your knowledge of understanding, hey, we gotta take care of ourselves. And I think I commend you. It really is starting early in your household. Is that how you were brought up, by the way?
No, it's definitely not how I was brought up. I'm a Chicago kid, and born and raised on Chicago food. Born and raised in the medical matrix, as my father was a cardiologist. So I'd like to say that even in utero, I'm listening to my father talk about cardiology stuff. So I wanted to be just like him. And my epiphany moment really came in my early 30s when I was with the biggest group in the state of Arizona. And my father was sick and dying of a Parkinson's-like illness. And the Mayo Clinic said they have no idea why he's sick and dying. And then I meet this 29-year-old chiropractor, and she tells me all the reasons why my father is sick and dying. So Mayo has no clue. She's got all the answers. And I listened to what she had to say. I started to change my life, started to change myself personally, started to change my practice. And then we would get married and have 4 children. Now the 4 children, eat well, live well, think well. That's how we live. Now, they were in school for a short time post pandemic. They were now out of school. We just live on our ranch and we have fun and we do all the outdoor activities, all these things that we really need to focus on. But I think ultimately it's going to come down to the individual. I don't think there's any life preserver coming from government or pharma, or the medical industry whatsoever. It's not going to come from regulating television ads. It's going to be a ground up type of approach. It's going to be really just kind of one by one, like the three of us and doing what we're doing right now, sharing the message. And everybody who hears this, they share the message, and they never stop. I mean, Wendy will tell you, right, Wendy? I mean, the key of a good marketer is like you never stop. You're always marketing. Wendy Stevens is always on. Jack Wolfson is always on. You, Ray, again, like same thing. I'm always on the stump. I'm always talking. I'm never going to stop. I'm going to always keep on mission to do what I'm doing. And that's how the revolution is going to be from the ground up. It's going to be, again, this thing where, freedom of information. I'll use this opportunity to talk about freedom online and freedom of speech. You can agree with us or disagree with us, but let's all agree on the freedom of our opinions. And ideally, social media would agree with that as well. That, hey, we can talk about whatever we want to talk about. You want to talk, again, you want to talk about health, you want to talk about wellness, you want to talk about, any kind of freedom issue. We should be free to have these conversations and freedom to question these, and then freedom of the healthcare decisions, because the other side doesn't want that. The government doesn't want freedom. Healthcare, sick care companies like pharma and insurance, they don't want that either. It was kind of news to me. Insurance, they want costs to go up, because as costs go up, then they just turn around and go to the government and say, give us more money to cover all the rising costs. They love it.
No, it's even worse than that, Dr. Wolfson. So there's something I'm sure you're probably familiar that's baked into the Affordable Care Act called the MLR, the medical loss ratio. And the medical loss ratio says that for every dollar an insurance carrier takes in, they get to retain 15 to 20 cents on that dollar, depending upon the size of the organization, for administrative overhead and profit. And so, on the surface, it sounds like, well, it's perfectly reasonable. They should be spending the majority of that dollar to dispense care in claims. But if you're sitting on a board at one of these insurance carriers, in order for you to make more money for your shareholders, which is where your fiduciary obligation is, what has to happen next year? Do claims need to go up, or do they need to go down? They have to go up. If they don't go up, you're costing your shareholders money. And so I am with you 1,000%. I am 100% capitalist through and through. I believe in America. I believe in freedom. I believe in all of that. But I think at the root of the healthcare problem, there's something fundamentally wrong with insurance carriers being for-profit entities when their incentives are not aligned with their policyholders. And I don't know the answer to that question. I don't know. I certainly don't want government to run insurance, but something with that model has to change, because that's a huge issue.
Well, you explained it. You explained it a lot better and more in depth and succinct, than I did. That's for sure. And to think about that, what's happening right there, like you said, and it makes it very difficult. And that's why it just has to come down to the individual consumer, to the best of their ability, and the best we can get this information out to people. But it's like Ronald Reagan said, the problem's the government, and he was right.
Wendy,
Well,
yep.
real quick, the Jack's so right, and at the end of the day, it comes down to getting out there. However we do, whatever you're passionate about and believe in. I found Dr. Wolfson as the direct result of the personal impact of having a crazy accident during a surgery that left me less than the World Cup All-American NCAA championship athlete that I had been in my life. And I was at a place where, my dad was a doctor too. He was having medical school, but all of that best thinking that doctors were one step below God left me in a really rotten spot. So I searched for answers, researched around, which is why Dr. Wolfson writing a blog about nanokinase, a Japanese seaweed that I was looking up when I was looking for a natural solution, so I wouldn't have to be on rat poison, which is what I was on. And so I discovered Jack, researched enough to find out he was real. His work was real. Board certified cardiologist, who then learned what really happens. And I got on a plane and flew out to Arizona to meet him. Literally, it was because of a blog post. So that's why a podcast, a website, all of this stuff matters, because someone that's hungry, motivated, thirsty for truth in what actually works will have tentacles to be able to research and do their due diligence and find out. And because I found Jack Ray, I will live longer. I am on half of my blood thinner dose because Jack read the source study, not the newspaper article or magazine for doctors about the study. He read the study himself. And he didn't have to slap down my cardiologist. He was just like, Wendy, ask your cardiologist, blah, 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 if you read the study. And only because Jack gave me source information did I have the sword for his nurse to get on the phone and talk with me. And we were able to make it kind of his idea. He got to be hero. But the truth was, I got the actual real source truth from Jack. And I will be around for more years with my grandchildren because of his work, period.
Amazing. And so, just a little bit more on that, Wendy. What was that? What was that journey like? Like, I know you well, and our audience doesn't know you exactly, but I know you pretty well. Jack knows you pretty well. You're not the average person that's the wallflower that's just going to kind of sit there and wither and listen to. Okay, I'm taking my doctor's word as Bible. You felt like, hey, I could do something more here, or I think. There may be a better way. And then how did you find Dr. Wolfson?
Sure. So let me real quickly how I got there with the least amount of story is I did not know that I was born with a bicuspid aortic valve. So it's a congenital defect. I didn't know when Len Bias died of a cocaine overdose when I was back in Maryland in 1986 that he and I had the same congenital heart defect. He died after one quick hit of cocaine. So I decided never ever to take a drug. But then I find out myself, at 50, we discover that all my athletic health checkups, including the Olympic Training Center, Jack, in Colorado, no one picked up that little teeny tiny clicking sound when you lean forward. And if a cardiologist doesn't know to listen for that, or a regular doctor doesn't know, then I passed under the radar. So I had my first surgery, hole poked through my valve. We didn't know why I was regurgitating and backflowing. Too much big story to get to it. But at the end of the day, I think I told you, Ray, I spent almost $5,000 out of pocket, out of network for a 4D angiogram to try to avoid a second open heart. Because as Dr. Wolfson knows, the mortality rate doubles in a second open heart. So we had to do the second open heart, and actually found a great surgeon, Dr. Riley, out in Scottsdale, Arizona. And we went in, a second full-on open heart. So I've got two zippers, and at the end of the day, they had to use a mechanical valve to fix, replace, pacemaker, etc. Thus, I wake up on rat poison, and I went on a blog, and that's how I found Dr. Wolfson.
Wow, amazing! Thank you for sharing that. And it really is it's a scary story, but it's also a very real story because I researched the surgeons that you had, and their scores, and there are scorecards, by the way, for physicians, for facilities, CMS, excuse me, the Center for Medicaid and Medicare Excellence Services. They have to report numbers every year, these institutions and these surgeons, and there are quality scores out there. And Wendy's surgeons they scored through the roof. They were very high. But, they're people, and it's not just the surgeon, it's the team. Who knows how long their shifts are and how long they've been on their feet, how long they've been operating. And sometimes mistakes happen. And so you can imagine Wendy is a world-class athlete, used to doing a lot more physically than your average person. And all of a sudden, Wendy, I think you found yourself winded doing basic stuff, right? That was like the alarm bells started going off.
Yep. And so then I get it checked out, and they show it up on the screen, Jack, in the hospital, and there's my valves. I'm like, oh, that's really cool. And my best friend, who is chief of hematology at Vanderbilt, was like, not really, because where you have two, you're supposed to have three. But if I skip past that, I'd love to have Dr. Wolfson comment on this. because I'm not going to name the surgeon, a world-class name, Ray, you do know who it is at the Cleveland Clinic in Ohio. And the only reason I'm not going to share the name is, you know what? I don't want another lawsuit in my world, really and truly. But
Yeah.
see, understand his great score, that surgeon, doesn't include me. Doesn't, because I'm not a fatality, right? As long as the scores know I'm a successful outcome, when actually I wasn't. And if you remember, Jack, when I had that echo, all my normal echoes after surgery were normal. I'm not going to call it Fox in the Hen House, but oops, I just slipped and said that. We found it later, almost 2 years later, in a follow-up. So how come it didn't show up when I went back to the Cleveland Clinic every time, but it showed up somewhere else? Then I have to figure out what's going on, and thus the second surgery. So,
And
Jack,
also, Wendy, they do score for readmissions, but in your case, you weren't a readmission because you had
Jack,
surgery elsewhere.
That's right.
So
I got the new echo that showed, oops, Houston, there's a problem.
yeah,
I called the Cleveland Clinic, and my surgeon refused to even look at this other echo. Oh,
Yeah.
no. You have to fly here, and we'll repeat all the tests. Refusing to even look at it, I was blown away.
Yeah.
So, Jack, what can you comment on that for us?
Well, I think the main thing really here is that we just need to be our own advocate. Unfortunately, we can't totally trust the system. And it's not a condemnation necessarily of the doctors. It's really, again, just a systemic problem. And we need to be very aware, and not only ourselves, but also our family members. So should something happen to any of us, our family members know, certainly our wishes, but they're also there and ready to be our advocates. There's so much medical error. There's so much pharmaceutical error. There's so many negative consequences of the pharmaceuticals. So unfortunately, we just need to really take charge of our health. We're all really good at, if I want to buy a house or rent a place, I'm really good at researching that, or, an Airbnb, or I want to get a new car, or to get a new bicycle, or whatever. We're so fantastic at researching everything. Where we want to go to eat, we'll spend more time researching a restaurant than we will who our doctors are and the procedure or the pharmaceutical. We just have this blind trust, and it's led to a lot of damage and destruction. From day one, the students, the doctors who become doctors, the control of the education is the pharmaceutical industry. They control the medical schools. They control the societies, American College of Cardiology, American Heart Association. These are bought and paid for by pharmaceutical companies. So we really have to be our own advocate.
Right.
Yeah,
and
no doubt.
Jack, going back to that one piece, of course, the original 10 medical schools were funded by none other than DuPont. And of course, there's a movie out now about DuPont Chemical and the poison of but my point being on that, what is it, Jack? A doctor, the average med student gets one course on nutrition out of all those years. Is that unbelievable? That blew me away.
Well, we get zero training on causation. We get really good training on if you have a heart attack, here's your pharmaceuticals. If you have heart failure, here's your pharmaceuticals. If you have cancer, here's your chemotherapies. We're really good at that. We're really good at the diagnostic stuff. Let's order a CT scan, an MRI, an echocardiogram. But as far as causation, why people get sick, we're terrible at that. And one thing that we use very often, people will hear, is that they have a family history. Well, it's in your family has this. What's your family history? Oh, well, if your family had it, there's nothing you could do. You got to take our pharmaceuticals. When I love to tell people that our genetics, because family history, I think, is similar to genetics, our genetics are perfect. We are built perfectly. Our DNA is perfect until man-made poisons, and I'm blaming the men for this one, man-made poisons screw it up. And so when you eat like your family and live like your family and think like your family, you suffer the same diseases as your family. It could be heart attack, it could be Parkinson's, it could be cancer. But it's not a problem with your genetics. Your genetics are perfect. And if you give your body what it needs, take away what it doesn't, that's the strategy.
Yeah. I'd like to go back to my neighbor for a moment. So you put yourself in his shoes. You go to a cardiologist. They tell you have a 25% blockage of your widowmaker, and you need to go on a statin. And now he comes back and he says, I don't want to do that. What is their rationale going to be for him taking that statin? Is there, how do we address the 25% blockage? Is that addressed by taking a medication? Is that mechanically removed? Or is it simply something that we all have a certain amount of plaque in our arteries, and your body is going to deal with this? But what would you recommend in a case like his? And what is the counter argument? I want to. That's what I'm really interested to know. Like, why is that physician prescribing that statin? Do they really believe that that's the only course of action?
Well, that's the only thing that they're trained. They're only trained that that's the course of action. That we put the person on statin drugs, we put the person on aspirin, and we wait. We watch and we wait. That's all that we have. Sadly, that is the reality. Versus when you come to my company and other natural providers as well, we say, okay, well, listen, let's view this whole process through the lens of eat well, live well, think well. We call this the 100-year heart method. And then we test, don't guess. We use the most advanced ultra diagnostic testing in the world: blood, urine, stool, saliva, whatever's necessary to look at all of the different markers that the person has. So we can look at cholesterol, things like that. But more importantly, I'm looking for markers of inflammation and oxidative stress. And if those are elevated, the answer is try and figure out why. We're always looking at why a person develops a 25% blockage. That blockage may have been there, again, because they grew up in a house with secondhand smoke. So now they've got some degree of coronary artery calcification. We know that people who grew up in secondhand smoke have a higher incidence of coronary calcification than every other cardiovascular disease, and every disease, for that matter. But there's nothing we can do about the secondhand smoke as a child, but we can look at all the risk factors and markers right now and work to fix those now with the method of eat well, live well, think well. That's what I would tell your friend. Statin drugs will lower numbers down. They will lower the numbers, like as you said, from 240 to 160. But the question we need to ask is, does that lower my risk of heart attack, stroke, and dying? And the answer is, some studies say yes, some studies say no. If there is a benefit, according to recent meta-analysis, it's a tiny benefit, less than 0.2% benefit for these people who are taking it for primary prevention. It's not good enough, because it's not about how do we reduce the risk of a heart attack from 2% to 1.8%. It's how do we reduce it to 0%? That's the goal.
Right.
And Ray,
sure.
can I dovetail on that real quick?
Please.
We're
Yep.
talking about prescriptions. So once again, when I sought out Dr. Wolfson and I dove in, and I had a couple of members of my family like, what are you doing spending several $1,000s on really deep diagnosis on your diet and whether I'd had mold exposure and all these other pieces? And I was like, you know what? It's pay now or pay me later. And I had already gone through $500,000 and, post costs and surgery costs and all that other stuff. So thankfully I did do that. I sought Dr. Wolfson out. I sat down and I decided to shut up and listen, because what I thought was going to be the best path of health for me and what was actually true all of a sudden collided. And I found there were two different things. And I took out, Jack, you remember, it was in the beginning, it was 2 months of my life. And I flew to Thailand, and Dr. Wolfson was fabulous enough to consult with the gentleman that's a holistic oncologist over there. Yes, that had hired me for marketing, by the way. But as a direct result of Jack's participation, medically supervised, I was able to get off, because we have 2 surgeries. What do? Throw tons of poisons at you to knock you out, and then throw tons of drugs on you afterwards to make sure they can get you out of the hospital and it's not on them. So I actually peeled away and came off of 1, 2, 3, 4, 5, 6 prescriptions as a direct result of Dr. Wolfson's approach that we're talking about. And by the way, my blood pressure is handled naturally, 110/60, fantastic, all of it. So anyway, we all have a little clock, and it's called TikTok, whether you believe in that platform or not. tick tock, and my tick tock is going to go longer, even though my pacemaker, Jack, is getting near the end of its battery at this point. But the truth is, Ray, I believe in supporting holistic physicians so much because I'm going to be around longer, and I need the people that I love about to know that this is real and it's true. Don't believe it. Find out for yourself. Do source due diligence. Jack, what do you
Amazing.
think?
Amazing. So I went to an acupuncturist in Manhattan. His name was Ken Kobayashi. He's been practicing acupuncture, comes from Japan, been practicing acupuncture since he's a toddler, runs in his family for hundreds of years. And he used to tell me, he used to say, Ray, body here is self. Your body heals itself. And he said, body is made up of 60 billion cells, and body here is self. And he used to say, he's actually an MD, a dermatologist, and he became disenfranchised when he was, being told that he had to prescribe steroids to patients, and he just didn't believe in that, and so he went the complete natural homeopathic regimen. But the concept of the body healing itself and putting good things into it, Dr. Wolfson, I think that's where did you and we're going to wrap up shortly, but I'd love to to have you just touch on because it seems like you've gone down the path now of natural medicine. It didn't start that way, but you had a transition at some point, and was that your wife, or how did you what kind of took you over the top?
Yeah, I would definitely give 100% credit to my wife, no doubt about that. But, listen, I saw the sickness in my father. I saw the sickness all around me, and the medical system is not working. If it was working and all these drugs were working, why would cardiovascular disease still be the number one killer worldwide? Millions of heart attacks, millions of strokes, 100 million Americans on with high blood pressure. Does everybody have bad genetics? 100 million Americans with high blood pressure. So clearly, I recognize that my wife was onto something. And there's a lot of other practitioners like this. There's a lot of training institutions like this. There are health coaches, medical doctors, DOs, chiropractors, naturopathic MDs, a lot of people on this. I was a contributing author for the textbook of integrative cardiovascular medicine by Dr. Mark Houston, by Wendy's alma mater at Vanderbilt, Dr. Mark Houston, MD. I mean, people fly from all over the world to go see that guy as well. So it's becoming more mainstream, that's for sure. But there are a lot of barriers against us, and we'll just keep fighting the good fight to get people the truth. It's not your genetics, it's not your DNA. It's not preordained. You can do this. You just got to get help. You got to work with someone who is a holistic provider and get those answers. And I think that's going to be the best plan for anyone.
So do you agree that there is a marriage between East and West, that both have a place, and that they not necessarily need be mutually exclusive? What are your thoughts on that? All Western medicine, all drugs obviously are not bad, correct?
Well, there's a time and a place for certain pharmaceuticals in certain situations, but it should also be at the end of the game. We should try eat well, live well, think well, test, don't guess, evidence-based supplements, other biohacking strategies like sauna, IV, red light, a lot of different things we can do in those areas. And then if we're not where we need to be in that situation, then we need pharmaceuticals. I mean, Wendy has a mechanical heart valve, and Wendy and I have talked about this. And if anybody, as Wendy will tell you, would want to get someone off of warfarin, which is, the brand name Coumadin, it would be me trying to get Wendy off that. But at this stage, we can't. Hopefully, another pharmaceutical will come down the road to replace that. Right now, there's not. So there is a time and a place for pharmaceuticals. But again, it should be as a last option or as the only other, resort. And as we said, emergency situations, trauma. Listen, if a bone is broken and sticking out of your skin, and you need to go to a trauma doctor. But when it comes to prevention, treatment, reversal of chronic illness, things like obesity, diabetes, high blood pressure, inflammation, arthritis, thyroid, whatever, the medical community has nothing. They've got absolutely zero when it comes to true prevention.
And Ray, real quick, if again, just to be clear, my first open heart was to replace that bicuspid valve, which was with a bovine valve, like the first time. And if that had been done without some surgeon poking a hole before they sewed me up, I wouldn't be on Coumadin. So I'm on Coumadin as a direct result of a surgical error, quickly sew me up and get me out of the OR. That's the reason I'm on Coumadin. So, but I'm on half the dose that the system was telling me I had to have. So anyway.
Well, and I will say this, to Wendy, is that if we just kind of believe in spirituality and why things happen the way they do, and of course it's difficult to say for a woman with multiple surgeries and mechanical valve and pacemaker and on warfarin, for the next 50 years. Again, the fact that happened to you led you to meet me. Led us to get more of this information out there, to get this information, to Ray, and to share all this stuff and hopefully change lives. I love to say that my father's demise, created what I am today. Now, I wish to God, of course, that I think about my father every single day. And I wish that he was here with me, but it's all part of the story and part of, how we continue to get that message out there to reach more people. So there's something bigger at play here.
Awesome. I couldn't agree more. Dr. Wolfson, thank you so much for being our guest today. I've learned a lot. I'm sure our audience has learned a lot. Really appreciate you. Do you accept new patients, and how can people find you?
Yeah, we do. Our company's called Natural Heart Doctor. That's the website, naturalheartdoctor.com. It's myself. We have another cardiologist, Dr. James Kneller, who's absolutely fantastic. 2 naturopathic doctors, a chiropractor, and an anti-aging nurse practitioner, and also a team of health coaches around the country. So we've got a really good support network, website and blog and free information for people. So I think, as Wendy said, sometimes you really got to invest in your healthcare, but it could be just as simple as things like eat more seafood, get better sleep, get more sunshine, be more physically active, look for environmental toxins and pollutants, especially mold mycotoxins. And that's another show for Wendy and I maybe to do together to circle back on the mold story. But, really it's like, as you dig deep with this concept of eat well, live well, think well, that's how you're going to get your, really all those different benefits. It's not as easy as just, hey, swallow a pill. And also the think well component, again, as Wendy knows, it's about finding your happiness. And when you're happy, you live longer. So work to find your happy.
Awesome.
All right, Ray, one last time. You ready? Because I chose to, again, pursue one of Dr. Wolfson's health coaches, and I've dropped and kept off 20 pounds since working with, and you know which one, Jack, but he does have an amazing team. I keep Jack as the captain of my ship. Once a year, we take a look at absolutely everything, and then I'm in charge of taking care of me in between. But I love having the help of a health coach as well to support the process. So I couldn't recommend it more highly. Absolutely.
I love that you're doing that naturally, because I think so many people are looking for the easy button and they're going to Ozempic and drugs like Ozempic, and I just think, God, that's a recipe for disaster. It's you're not doing your body good, that's for sure. So, folks, I think we're going to leave it there. Thank you for tuning in. If you have not already subscribed, please subscribe. Follow Dr. Jack Wolfson. And Wendy, thank you so much. It's great seeing you as always. Until next time, folks, take care.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. And join us on the next episode.